Thank you very much. Welcome, everyone. Good morning. We've had some great opening sessions. I'm in my 6th year as president of GS1, and the original proposition when I joined was that we could save thousands of lives and save millions of pounds for the NHS through the adoption of GS1 standards. Terence posed the question earlier on, where's the evidence base? And increasingly, the evidence is coming through. That not only can we do it, but actually we can do it in year. In terms of where we're going, we've heard from Matthew, the long-term plan, the technology drive. Everything, it seems to me, is coming into place to enable the NHS to use GS1 standards to really help them drive forward their agenda. Of course, it's easier said than done. There are huge pressures on people in the system, people in the room, people on the platform. But nonetheless, the goal, I think, is becoming ever clearer. And it's very exciting to have colleagues here who've been using GS1 and seeing some of the impact. We've got about 20 minutes where I'm going to ask colleagues to, first of all, just tell us a little bit about what they've been achieving, and then hopefully we'll get some discussion going. I want to start with Cara as CEO of a trust. Would you just tell us a little bit about how you've been using GS1 standards?
Yeah, no, of course. I think the biggest thing that I'd like to say is that the GS1 standards really underpin everything that we do at Salisbury, because our ambition is around outstanding care and experience for our staff and our patients. And what we've seen over the last few years is a real difference that the programme has made in how we work and certainly how our clinicians work. We now, for all of our surgical specialties, have scanning, point-of-care scanning across. So we have now records of over 30,000 procedures that we undertake every year in the organisation. And that detailed information has then meant, particularly for our orthopaedic teams, in their kit setup, we now have 2 years of data that has really allowed us to polarise, I guess, the equipment that they're using, but really create bespoke equipment for them and kits for them that improves the work that they're doing, but also saves an inordinate amount of time for our theatre staff in getting products ready and making sure that that's available. So that has made a real difference for the staff and how they spend their time. I think the other thing that stands out for me is the opportunity that it creates around safety alerts. So recently we've had the safety alert around the reconstruction trauma templates. And what that's meant for us is that within a matter of hours, we were able to recall the patients that we'd inserted that piece of kit into and actually be able to be in contact with them. Many other organisations nationally are now trawling through manually 2 years' worth of x-rays in order to find that product. So that the recallability and the ability to see what we've done in real time and then track that over a period of time and start to look at the relationships and the things that creates makes a real difference for how our clinicians are working and the conversations that they're having.
And would you say clinicians that has helped clinicians really gain ownership of what you're doing?
No, absolutely, because we are doing a lot of work around how we need to digitally mature as a trust, and there's been varied clinical engagement, particularly just because they've had some poor experiences previously, and the Scan for Safety programme has just really changed those conversations because it's something that they feel absolutely engaged in. It's things that they're interested in, and they can then see in real time the impact of the changes that they're making and the impact that has on how they're working.
Thank you. Raj, you've just taken over a trust that has a great safety record. How do you see GS1 helping you improve that?
We weren't fortunate enough to be part of the Scan for Safety programme, so we've been feeding around the edges looking for the scraps that we could bring into our organisation. And I'll just use this narrative to bring it to life for people. Our organisation at Salford Royal is an organisation where we were very, very data rich, and we could do some great work understanding primarily how effective and reliable our clinical processes were. But as we looked at that data, we recognised there was a significant gap in that data set, principally around products and other activities that were associated with clinicians. We looked at GS1, and we could see in GS1 something that was entirely consistent with our digital strategy about open standards, the ability to interrogate data right across our activities with patients and others. And so we decided 2 or so years ago to pursue GS1 by ourselves, and we've concentrated in theatres where there's one of the high product areas using the Genesis system, and we've also started building it into our contracts to make sure that we are GS1 ready for the future. And we're already seeing benefits in terms of, for instance, around morbidity reviews, where we're able to pull data around a death in theatres, that unusual circumstance. Learn a lot more from that mortality review because we've got so much more rich data. We can track things and understand, you know, if things went wrong here and track it all the way through, as opposed to just having a single channel to look at it with. So we're totally convinced.
How crucial is it that at your trust over many years you've had a strong commitment to safety and quality improvement?
I think that's the defining factor for us in Salford Royal. We were able to energise our whole organisation behind the safety agenda. And it didn't matter whether you were a top brain surgeon or whether you were a porter on the shop floor, we all got behind a single purpose. Important to our methodology was measurement and understanding whether we were making progress. To measure, you need data. And you need to be able to gather that data in an effective and cost-effective way. So the secret sauce of our types of organisations is purpose and real, you know, embedding that into culture, but it's also we're being really disciplined about measurement.
Okay, thank you. Alan, you've got one of these crucial jobs leading STP, Integrated Care System. At GS1, we always thought that some of these changes would could lead going from an institutional use of GS1 to a system use. In a sense, you are that in practical action. Could you share some of the potential that you see in leading integrated care systems using GS1 technology?
Absolutely, and I think you know, following on from some of Matthew's presentation, I think we can see how we can do things at scale. First of all, across North Cumbria in the northeast, I see it as a great opportunity in leading, system leadership, which requires the leadership to bring organisations together. It's about relationships, and we've got a real opportunity to move to the next stage in terms of how we use GS1 standards, which we've done at North Tees and Hartlepool Foundation Trust. And Glenn made a comment about what we're doing there in terms of you know, rolling it out across a single organisation. We will be working with partners in the south of our region to take it to neighbouring trusts, and the ambition is to roll it out right across Cumbria in the northeast in the way that we've talked about already. What I would say is, linked to that, we've got to get the basics right and build the good foundations. The foundations for me, building on the 4 global digital exemplars that we've got in the northeast, North Cumbria. We have an ambulance trust, and we're going to hear from them later in the conference as a GDE. We've got 2 acute trusts, one in Newcastle and one in Sunderland, and we've got mental health as well. So we've got you know, four different organisations, from the biggest teaching hospital to another specialist centre. Then we've got ambulance and we've got mental health. So we're really well placed. We've got high levels of digital maturity, but we have some pockets within the patch that need to really move up. But learning from each other, we've got the ability to be able to do that. And the other thing we've done in the northeast is we've had a successful bid put forward and supported for academic research. We didn't have a clerk, as they used to be called, or an ARC in the northeast as it is now. So we've got applied research capability, working with universities, using big data, and we've got all the key universities of the northeast tied into that. And the other link that we've already made is linking that with the work of the Academic Health Science Network in the northeast to get translational research. And again, really excited about the research capability that this will give us in the future. And that links to the Great North Care Record, or our LICRA project, which again makes that capability available at the front door of in every care setting. But clearly, when we use the GS1 standards and we can get live data linked to care records, that will make an enormous difference.
And I mean, clearly, you're leading a big patch with lots of different organisations. You've clearly got a variation in digitalisation. The organisations that have been need to speed up, I mean, what's the trick to really get them to play?
Well, as GDEs, we've got 4 fast followers as well. And so what we're trying to do is learn from the best. What we're also trying to do with our digital strategy, one of the big platforms for the integrated care system, which all of the chief officers have signed up to, is digital, the digital transformation that's needed. And whilst we need some variation, what we're looking is for some system convergence to try and get the digital maturity quickly up to speed and in place in those organisations that require some help. And they can learn from the fast followers, and they can learn from the likes of North Tees that have put Scan for Safety or the GS1 standards in, and we've got neighbouring trusts coming to see what we're doing and how we're achieving already. Linked to that, I'm hoping as the leader of the integrated care system, I can provide some incentives linked to capital monies in the future, and also linked to other developments and the new money coming on stream. And we're going to support primary care networks, because that development as well will make a huge difference to the out-of-hospital
Great, thank you.
Use of this data. Thank
you. Nick, you're going to be talking tomorrow in the technology sessions. Can you give us a little preview about what you're saying and how you've been getting on in Plymouth?
Yeah, so I'd probably highlight something before that, which was last year was really significant for us, in that we got our Scan for Safety accreditation. And that was really important from a board perspective, because it gave us an independent review of all the work we'd been doing and signing off on the programme. And really important part of that was it gave us an independent confirmation of the financial and non-financial savings that we'd made. And that made it a really easy business case to ensure that we can put in place the resources to support Scan for Safety going forward. So in total, I think we saved over £1 million. That makes it a very compelling case for any trust board to say we need to keep on going with this work. Now, obviously, the money isn't to be on an end all here, and the primary focus is patient safety, but it just allows us to get the resources in place. That'll allow us to continue to roll out the programme of work across theatres and a whole bunch of other stuff we've already started. But it's also allowed us to set 3 new ambitions. So the first one of those is a piece of work we're doing with Genesis on inventory management, where we're looking at how do we use that technology to reduce the never events within theatres, so specifically targeting wrong size, wrong site surgery. We're doing a piece of work with UCL in partnership, which is very exciting. We are going to talk about this tomorrow, using a standard called EPCIS, which allows us to take the small pieces of data that we capture every time we scan an event, and allows us to store that in a standard open format, which then allows other applications to access that information and to give us insight into how we run our businesses and how we support patients in their care. So we're going to talk about a bit more about that tomorrow. And the third one, it allows us to write the business case to support our asset management tracking across the organisation. So we're out to the marketplace for that, and we'll be writing the business case over the next 6 months. So some big, exciting ambition.
Can you just talk about that £1 million for a minute?
Yeah.
Over what period did you achieve that?
So that was achieved over an 18-month period. So I've got the numbers on a slide for tomorrow, but probably about 700,000 of that was cash, and the rest was time savings through things like reduced admin, product recall reductions in admin, filling in registers, and avoiding stockouts in theatres, a whole raft of...
And that's recurring, essentially?
Yes.
That's quite a figure, isn't it, in terms of convincing people that this is a path down which they can go?
And I think also it builds on, if we can make this an absolute no-brainer for NHS organisations, it actually creates that momentum which drives the market. and we'll actually see greater take-up of the standard across the entire marketplace.
Okay, so Matthew, you know, you've heard 4 colleagues talk about what they're now achieving in the field using GS1 technology. It's impressive, isn't it? And yet, and we also have a Secretary of State interested in technology who has said in one of his key speeches only about 4 weeks ago he'd like to see, starting with all acute trust, enthusiastically adopt GS1 standards. Have we got the momentum now, or do we need another great push? From your vantage point, what would your advice be to GS1 and to organisations here about really how we can just make that next step?
So I think my first piece of advice would be to not view this as a technology project. This is a management project, it's a change project, it's the way in which organisations run. This is chief executives leading these programmes. This isn't a group of CIOs sat up here, and I think the standard is crucially important. I think the driving it into integration with the technology we've got, so it's not just another thing you've got to do, but actually integration. You've got good organisations here who've done that thinking. But the real question now is leadership. It's going to be because you can't turn this project into £1 million worth of savings unless leaders drive the changes through. And I think that is the crucial piece here is the project has demonstrated that it can pay for itself. It has demonstrated that if you lead it well, you implement it well, and it becomes part of what your organisation is doing, it's good for safety, it's good for money, it's good for it integrates into what you're doing. But so I think the challenge to the room is to take it away and prove it for themselves in the way that I think Salford saying we weren't lucky enough to get a handout from the centre. Well, that creates a rigour around what you're going to do then, because it becomes there's a real cost to your organisation of not making it successful. And I think that's where we are now.
So the agenda you put up very succinctly, the NHS long-term plan. You know that leaders out there have got formidable challenges at the moment, and it's the day-to-day challenge and pressure alongside making the changes and driving forward the kind of integrated approach that you've put up there, which I think, as you said, it's the only game in town, because if we carry on the way we're doing things now, we simply cannot meet the kind of demand that we can expect. So I guess we still come back to this issue of leaders, you know, the 200 or 300 people who lead organisations. You've got great examples here of people who've really taken this forward. What is it that we can do to persuade leaders that actually we are part of the answer to some of their challenges?
So I think it's probably three things. First one is what I was trying to say in my talk was you could tick all the boxes in the long-term plan and miss the point. There is a societal change going on around us. There is a set of challenges for the NHS that's sustainable, and as leaders, you need to not only embed that, but be thinking through what that actually means for your population and your organisation and how that works as a system. So I think the first thing is to ask yourself the bigger question. I think the second thing is the NHS has a hero mentality. One leader will transform stuff for you, and actually it is the several hundred leaders across an organisation. It is the leaders on every ward, in every clinic, in the pharmacy, in the labs. And if we don't get that kind of engagement into the half a dozen things that systems and organisations need to get done, we won't be able to make that change. And I think the third thing is to be honest with yourselves about where your weaknesses are. So the sense that there is improvement, there is in waste. Maybe the one good thing that will come out of the Brexit debate is that we now know something about the NHS supply chain that we didn't know previously. The potential for saving now that every organisation has had to go through every single product. If we just carry on doing what we were doing at the end of this, it will be such a waste when we could standardise and normalise and use this sort of data to drive improvement.
Can I write that down? One good thing out of the Brexit?
if we don't collapse back into the Stone Age.
Cara, I mean, what do you think of that? What would your message be to us?
So I think the opportunities are endless, if I'm really honest with you. And I think the work that we're now taking forward is tracking across entire patient pathways from end to end to really understand not only the product usage, but what I'm much more interested in is the interactions that they're having, what we're doing, how we're spending time. And for me, the art of the possible is then taking that and then rolling it out at system level and across acute, but also across the community. So if you think about what Matthew said about reducing variation, there is a massive opportunity around really understanding that variation of practice and that variation of input that then helps create those different conversations between clinicians about what great looks like. But more importantly, if you think about our most complex patients that are out in our systems and that, you know, if we are all going to live to 150 or near that, there is something for me around understanding how we avoid duplication, how we use the resource that we have in the best way possible, and the ability to understand what happens across an entire system for perhaps our most complex patients will dramatically change around how the different parts of a system work together, but also create that unity around a single patient, because we'll all have a single version of the truth as well. So I think it's really exciting.
Alan, do you think your other STPs, ICSs, will pick this up?
I think they will. They can't afford not to in terms of moving this forward. I mean, on the leadership point, yes, it can feel a little lonely at times leading an ICS moving forward. But the serious point is, you know, we need leaders at every level. But this is not a technology project. I think Matthew said that. You've got to view this in terms of what it is. It needs to be clinically led. We need the clinical champions, we need the clinical leaders to embrace this, because it's about quality, safety, as well as it will provide lots of efficiency going forward. And that research database that we talk about creating is really rich, and that in itself can provide real value for the NHS going forward. So the clinical leaders and clinical champions in our clinical networks absolutely vital to this.
Have you found that, Nick, in terms of clinicians owning?
Whenever we engage with clinicians on this subject, they absolutely buy into it immediately. I mean, they see it as, well, it's something I can do in the supermarket. It's a really natural thing to be doing in a work environment as well.
Yeah. Raj, this issue about variation, one thing I was thinking when Matthew was talking about both the strengths of the NHS, some of its challenges, is the US Commonwealth Fund indicators, which they produce every 2 years, showing us against about 12 other healthcare systems in the developed world. And we usually come out number one. And the reason is they have a weighting towards efficiency. And the one where we're really bad is outcomes, along with the US, which is even worse than us in terms of overall health outcomes. And we know from OECD comparators, we don't do all that well on a lot of clinical outcome indicators. I think the message that Matthew's given us is if we could deal with variation, actually, we would close a lot of that gap. Now, Salford, and you're now in a wider organisation, grip this up really early on. Do you feel that GS1 technology, allied to clinical leadership, is a way in which the variation issue actually can be dealt with full on?
Sure. There's two vectors on this from my perspective. There's one is the continuing investment we need to make in our staff, both in terms of leadership, but also their ability to adapt to digitally enabled technology and what that means for their practice. And the second one is quite simply a feedback loop. What our staff are desperate for is understanding whether the interventions they are making in hospitals, clinics, and patients' homes actually have the desired impact from when you look through the patient's eyes. And when you can actually close that feedback loop with our staff, with our patients, and provide really good data about the impact of what they're doing with those outcomes, you get some magic happening. You see both reliability going up, but also innovations that lead to better outcomes for the patients. So GS1 in that data, being able to provide data in a way that we haven't really been able to access it before. It's in volume, a level of cost that's really effective for us is going to be a really important ingredient in that feedback loop.
Okay, thank you. There's a red light flashing, which I think means we need to go to coffee and networking before the next sessions. I think that's been a really very interesting introduction, both from our three speakers and then the panel. At a time when this country and the NHS faces enormous pressures, I think that we've seen some real sense of optimism, that actually momentum has been created, that GS1 standards can help the NHS drive forward the essential changes they need to make. And I think that's a really good way to finish our first session. So thank you to my colleagues, and please go for coffee. Thank you.